Here's something that might upset a lot of dermatologists, but it needs to be said. The standard approach to hair loss treatment, oral finasteride and topical minoxidil, might not be the optimal strategy for most men. And there's a growing body of evidence suggesting that a combination of topical treatments could be more effective, safer, and give you better results with fewer side effects. This isn't some fringe theory or alternative medicine nonsense. This is based on peer-reviewed research and real-world results from thousands of men who have tried both approaches. Now, before we go further, let me be clear. Oral finasteride works. Minoxidil works. They're FDA approved, they have decades of research behind them, and they've helped millions of men keep their hair. I'm not here to trash these treatments or tell you they're garbage, but I am here to challenge the idea that they are the only option or even the best option for everyone. Because for many men, especially those concerned about side effects or looking for maximum efficacy, topical combinations might be the smarter choice. Let's start by talking about the problems with the standard protocol. Oral finasteride is a systemic DHT blocker. It reduces DHT levels throughout your entire body by about 70%. And yes, that stops hair loss for most men who take it. But here's the issue. You only need to reduce DHT in your scalp. You don't need to reduce it in the rest of your body. DHT has important functions. It plays a role in muscle development, libido, mood regulation, and other physiological processes. When you take oral finasteride, you're creating a systemic hormone change to solve a localized problem. That's why some men experience side effects. The reported rate of sexual side effects is somewhere between 2 and 5% in clinical trials, but many men suspect the real-world rate is higher because not all side effects get reported. And even if it's only 2%, if you're in that 2%, the statistics don't comfort you much when you're dealing with reduced libido or erectile dysfunction. Then there's the post-finasteride syndrome controversy. Some men report persistent side effects that continue even after stopping the drug. The medical establishment is divided on whether this is a real phenomenon or not, but the reports are numerous enough to create legitimate concern. And even if you're willing to accept the risk, the psychological burden of worrying about side effects can be significant. Minoxidil has its own issues. The topical version works well for many men, but it's a commitment. You need to apply it twice daily, every single day, forever. Miss a few days and you risk shedding the gains you've made. It can be irritating to the scalp, especially the liquid formulation with propylene glycol, and about 40 to 60% of men respond well to minoxidil, which means a significant percentage get minimal benefit. Oral minoxidil is gaining popularity because it's more convenient, but it comes with increased risk of systemic side effects like increased body hair growth, heart palpitations, and fluid retention. Again, you're taking a systemic medication for a localized problem. So what's the alternative? Topical treatments that target the scalp directly. The key advantage is that you get the therapeutic effect, where you need it while minimizing systemic absorption and side effects. And when you combine multiple topical agents, you can attack hair loss from multiple angles simultaneously, potentially creating synergistic effects that are more powerful than any single treatment alone. Let's talk about topical finasteride first. This is finasteride that you apply directly to the scalp instead of taking as a pill. And the research on this is actually really impressive. Multiple studies have shown that topical finasteride can be just as effective as oral finasteride for hair growth, but with significantly lower systemic DHT suppression. One study from 2021 compared topical finasteride to oral finasteride over 24 weeks. Both groups saw similar improvements in hair count and hair density. But here's the kicker. The oral finasteride group had their serum DHT levels drop by about 70%, while the topical group only saw a drop of about 25%. That means topical finasteride achieved the same hair growth results while leaving systemic DHT levels much closer to normal. Another study looked at topical finasteride at different concentrations. They found that even low concentrations like 0.05% or 0.01% were effective for hair growth. You don't need high doses to get results when you're applying it directly to the scalp. The medication reaches high concentrations in the scalp tissue where it's needed, but very little gets absorbed systemically. The rate of side effects with topical finasteride is dramatically lower than with oral. Most studies report side effect rates comparable to placebo. This makes sense because you're not creating a major systemic hormone disruption. You're blocking DHT locally in the scalp where the hair follicles are, but the rest of your body maintains normal DHT levels. Now, you might ask, if topical finasteride is so great, why isn't it the standard recommendation? Good question. Part of it is that oral finasteride came first and has the most established evidence base. Part of it is that pharmaceutical companies make more money from branded oral medications, and part of it is just medical conservatism. The standard protocol gets taught, and it takes time for new approaches to become mainstream even when the evidence supports them. But topical finasteride is available. You can get it from compounding pharmacies or increasingly from online hair loss clinics that specialize in custom formulations. The typical concentration ranges from 0.005% to 0.1%, applied once or twice daily. It's often formulated as a solution or a gel, and many formulations include other active ingredients as well. Let's talk about ketoconazole next. This is an antifungal medication that's available as a shampoo, most commonly at 2% concentration. You might be wondering what an antifungal has to do with hair loss. Well, ketoconazole has multiple mechanisms of action that benefit hair growth beyond just treating fungal infections. First, ketoconazole has anti-androgenic effects. It can disrupt androgen metabolism and reduce DHT binding to androgen receptors. Studies have shown that 2% ketoconazole shampoo can increase hair density and the proportion of hairs in the growth phase. One study even found that ketoconazole was comparable to minoxidil, 2% for improving hair growth. Second, ketoconazole is anti-inflammatory. It reduces scalp inflammation, which is a contributing factor in hair loss. Inflammation can damage hair follicles and accelerate miniaturization. By calming inflammation, ketoconazole creates a healthier environment for hair growth. Third, ketoconazole may have direct effects on the hair follicle. Some research suggests it can affect the hair growth cycle independently of its antifungal or anti-androgenic properties. The exact mechanisms aren't fully understood, but the clinical results are clear. Using ketoconazole shampoo is simple. You apply it to your scalp, let it sit for 3 to 5 minutes, then rinse. Most protocols recommend using it 2 to 4 times per week. It's cheap, readily available, and has minimal side effects. The main complaint is that it can be drying to the hair, but that's manageable with a good conditioner. And now let's talk about topical minoxidil. This is the most well-known topical hair loss treatment, and it's been around since the 1980s. Minoxidil is a vasodilator, meaning it widens blood vessels. When applied to the scalp, it increases blood flow to the hair follicles, prolongs the growth phase of the hair cycle, and can enlarge miniaturized follicles. The standard concentration is 5% for men, applied twice daily. Some formulations go up to 10% or even 15%, though higher concentrations can increase the risk of scalp irritation. Minoxidil foam tends to be less irritating than the liquid because it doesn't contain propylene glycol. The response rate to minoxidil varies. Some men are excellent responders and see significant regrowth. Others are moderate responders who mainly see stabilization with some thickening. And some are poor responders who get minimal benefit. Part of this variability is genetic. There is an enzyme called sulfotransferase that converts minoxidil into its active form, minoxidil sulfate. If you have low levels of this enzyme, minoxidil won't work as well for you. But here's where it gets interesting. When you combine minoxidil with other topical agents, you can often improve the response. Multiple mechanisms working together create better results than any single treatment alone. There are other topical options worth mentioning. RU58841 is a research compound that acts as an anti-androgen, blocking DHT and testosterone from binding to androgen receptors in the scalp. It's not FDA approved, which means it's not officially available through traditional medical channels, but many men source it from research chemical suppliers and report good results with minimal side effects. Tretinoin, which is a retinoid commonly used for acne and anti-aging, has been studied as an addition to minoxidil. Some research suggests that tretinoin can increase the absorption and effectiveness of minoxidil. It works by increasing skin permeability and potentially upregulating the enzyme that converts minoxidil to its active form. Caffeine applied topically has shown some promise in studies. It appears to have a stimulating effect on hair follicles and may counteract the effects of testosterone on hair growth. While it's not as powerful as finasteride or minoxidil, it's another tool in the toolkit that can contribute to the overall effect. Now, here's where we get to the really interesting part. What happens when you combine several of these topical treatments together? You create a multi-targeted approach that addresses hair loss from multiple angles simultaneously. You're blocking DHT locally with topical finasteride, improving blood flow with minoxidil, reducing inflammation, and providing additional anti-androgenic effects with ketoconazole, and potentially adding other agents that complement these mechanisms. This is what's known as a topical compound or topical solution. Many specialty hair loss clinics and compounding pharmacies create custom formulations that combine multiple active ingredients. A common formulation might include topical finasteride at 0.1%, minoxidil at 5 to 10%, and tretinoin at 0.01%, all in a single solution that you apply once or twice daily. And the advantage of this approach is convenience. Instead of applying multiple separate products, you're using one solution that contains everything. But more importantly, these ingredients can work synergistically. The tretinoin may enhance minoxidil absorption. The combination of anti-androgens and vasodilators attacks hair loss from two different directions. And because everything is topical, systemic side effects are minimized. There's actually research supporting combination topical therapy. Studies have shown that combining topical finasteride with minoxidil produces better results than either treatment alone. And when you add in ketoconazole shampoo as part of the regimen, you're stacking multiple beneficial mechanisms. Let me give you an example of what a comprehensive topical protocol might look like. You use a topical solution containing finasteride and minoxidil once or twice daily. You wash your hair with ketoconazole shampoo 3 times per week. Maybe you add derma rolling once per week to enhance absorption and stimulate collagen production. And you maintain a solid foundation of good nutrition, scalp care, and stress management. This approach hits hair loss from every possible angle. You're blocking DHT locally, improving circulation, reducing inflammation, enhancing skin renewal, and supporting overall follicle health. For many men, this combination protocol produces results that match or exceed what they would get from oral finasteride and topical minoxidil alone, but with a much better side effect profile. We've been observing this in the data from HairBuddy users. Men who use comprehensive topical protocols, especially those combining topical finasteride with minoxidil and ketoconazole, show really impressive results when they track their progress over time. The scans reveal gradual but consistent improvements in hair density, with many users showing stabilization within the first few months and actual regrowth by the 6 to 12 month mark. What's particularly interesting is that many of these users previously tried oral finasteride and either experienced side effects or were too concerned about potential side effects to continue. Switching to a topical protocol allowed them to get similar or better results without the worry and without the systemic hormone disruption. One user documented his journey in detail. He had been on oral finasteride for 6 months, and while his hair loss stopped, he noticed some sexual side effects that were affecting his quality of life. He switched to a topical solution with 0.1% finasteride and 7% minoxidil. Within 3 months of oral finasteride, his side effects resolved completely. And when he tracked his hair density with regular scans, he found that he maintained all the progress he had made on oral finasteride and actually continued to improve on the topical protocol. Another user started directly with topical finasteride combined with minoxidil because he wanted to avoid oral medication from the start. After 12 months of consistent use, his scans showed a 25% increase in hair density in his crown and significant improvement in his hairline. He experienced 0 side effects. For him, the topical approach was clearly the right choice. Now, I want to be balanced here. Topical treatments aren't perfect. They require consistent application, which some men find inconvenient. If you have very long hair, getting the solution to the scalp can be more challenging. And some people do experience scalp irritation, though this is usually manageable by adjusting concentrations or switching formulations. Also, while topical finasteride has much lower systemic absorption than oral, it's not 0. Some amount does get absorbed into the bloodstream. For most men, this doesn't cause issues, but it's theoretically possible for someone to experience side effects from topical finasteride, especially at higher concentrations or with large application areas. And we need to acknowledge that long-term safety data for topical finasteride isn't as extensive as it is for oral finasteride, simply because topical hasn't been used as widely for as long. That said, the short to medium term data is very reassuring, and the logical expectation is that reducing systemic exposure should reduce risk. Another consideration is cost. Custom topical formulations from specialty pharmacies or hair loss clinics can be more expensive than generic oral finasteride. However, when you factor in the potential cost of managing side effects or the peace of mind from avoiding systemic hormone changes, many men find the cost worthwhile. So who is the ideal candidate for topical combination therapy? I'd say it's men who fall into a few categories. First, men who are concerned about the side effects of oral finasteride but want effective DHT blocking. Second, men who have experienced side effects on oral finasteride and want to continue treatment. Third, men who want to maximize their results and are willing to use a multi-ingredient protocol. And fourth, men who are just starting treatment and want to take the most targeted approach from the beginning. If you're in advanced stages of hair loss with significant balding, you might need the more powerful systemic effect of oral finasteride. If you're someone who doesn't tolerate topical applications well or finds them too inconvenient, oral might be better for compliance. But for many men, especially those catching hair loss early or in moderate stages, topical combinations offer an excellent alternative. Here's how to actually implement this. First, you need to source the products. Topical finasteride usually requires a prescription and needs to be compounded. Online hair loss clinics like Hims, Keeps, Happy Head, and others offer custom topical formulations. You do a telehealth consultation, and if approved, they send you a bottle with your custom mix. For ketoconazole shampoo, you can usually find 1% over the counter and 2% with a prescription. Use it 2 to 4 times per week, letting it sit on your scalp for several minutes before rinsing. For application of the topical solution, less is more in terms of the amount. You want enough to cover the affected areas, but you don't need to drench your scalp. Use the dropper or spray applicator to apply to thinning areas, then massage it in gently to help with absorption. Most protocols recommend applying once or twice daily, ideally to a clean, dry scalp. Timing matters. Many men prefer to apply topical solutions at night before bed, so they can leave it on for many hours without worrying about styling or going out. If you're applying twice daily, morning and night works well. Be patient. Just like with any hair loss treatment, you need to give it time. You might see some shedding in the first few weeks as miniaturized hairs are pushed out to make room for healthier growth. Don't panic and quit. That's actually a sign the treatment is working. Visible improvements typically take 3 to 6 months, with best results at the 12-month mark. And please track your progress objectively. Your brain will play tricks on you. Some days your hair will look great, other days it will look terrible, and it often has nothing to do with actual changes in density. Take photos monthly in the same lighting and angles. Better yet, use a tool that can quantify changes over time. Having objective data removes the emotional roller coaster and helps you make informed decisions. We've seen with HairBuddy users that the ones who consistently track their progress are more likely to stick with their treatments and achieve good results. When you can see the gradual improvements in your scans, it motivates you to stay consistent. And if something isn't working, you can identify that early and adjust your approach. The bottom line is this: oral finasteride and minoxidil are not the only game in town. And for many men, they're not even the best game in town. Topical combination therapy offers comparable or superior effectiveness with a better side effect profile. You get targeted treatment where you need it, you minimize systemic effects, and you attack hair loss from multiple angles simultaneously. The research supports this approach. The real-world results support this approach. And increasingly, men are discovering that they can keep their hair without worrying about sexual side effects or other systemic issues. If you're currently on oral finasteride and happy with the results and side effect profile, great. Keep doing what works for you. But if you're experiencing side effects, or you're hesitant to start oral medication, or you just want to optimize your protocol, look into topical combinations. Talk to a dermatologist or use one of the online hair loss services to get a custom formulation. Your hair is worth saving, but not at the cost of your quality of life. Topical therapy offers you the best of both worlds. effective treatment that actually works without the systemic baggage. In my opinion, this should be the first line treatment for most men with hair loss. Start topical, track your results, and only escalate to systemic treatments if the topical approach isn't sufficient. That's the smart, evidence-based strategy that puts your overall health first while still giving you great results for your hair. Try it for at least 6 months. Track your progress with scans. See what your hair does. I think you'll be impressed with what targeted, multi-mechanism topical therapy can achieve. This might just be the protocol that saves your hair.